Hello, welcome to today's webinar from Bausch. My name is Mina Nazimi, and I hope that you can hear and see me. If you have any technical difficulties with the sound or problems seeing the presentation, please feel free to let me know either via the chat or the microphone option. I've started sharing my screen, and I hope that you are able to see the presentation that I'm sharing with you. I will try to keep an eye on the chat in the meanwhile. So please feel free to let me know if there's anything that you are unable to see. Okay, so I'm going to get started. Um, and Bausch and how this can be measured in our patients. So occlusion as a basic means any contact between the teeth of the upper and the lower jaw. And any restorations, for example, fillings or crowns, they mean an intervention in the system and must be monitored and adjusted by the dentist. Dr. Hans Bausch, who was a dentist himself, developed the articulating paper with progressive color transfer back in 1953 because he was aware of the importance of the masticatory forces and their effect on the occlusion. OccluSense by Bausch is another system to know so far. So I want you to think about what occlusion even is. My presentation is frozen a little bit. Bear with me one moment. Okay. All right. So what is occlusion? At first sight, a very much straightforward question to ask. But I bet you any money if I were to ask a few different professionals, they will give me a slightly different answer each time. So I want to touch up on some basics very briefly. So if we visualize the main aspects during static and dynamic occlusion and think about how we currently test this on our patients, then we have a standard that has been unchanged for quite a long time. So pre-cut strips, we have occlusion paper covering the full arch. They can be rolled and ready to cut. And obviously the different colors and various thicknesses with standard foils being 8 microns thin. And if we check occlusion in all 3 dimensions, we can primarily do this by using different colors. So in this video, you can see red being used for static occlusion, black for protrusion, and green and blue for lateral and mediotrusion markings. This is a very time-consuming matter, especially if you have to repeat the process. And that's exactly where OccluSense comes into play. So OccluSense is occlusion in a digitalized manner with an electric pressure sensor, a wireless handheld. You can place this in your patient's mouth and record any movement that you want. And for those of you who do not own an OccluSense system yet, I'm going to take you through the system briefly. So we have a set that consists of the OccluSense handheld. You need an iPad with an OccluSense iPad app installed. This app is available to be downloaded for free on the Apple Store. as well as a sensor. And this sensor is available in two different sizes. So we have X and XL, and these sensors differ in width rather than length. So they're highly sensitive, able to detect 256 different pressure levels and still remain 60 microns thin. They're still very thin and flexible in their handling. So they can be very easily inserted into your patient's mouth. And one very extremely important factor to me is the red color coating. So this method of occlusion control, it still leaves marks inside the patient's mouth. And just like the standard occlusion papers, you can use it once and leave all the marks where you need them to be. To first get started, you need to do an initial setup. And for this, you need to ensure that your iPad is connected to Wi-Fi. You then go onto the OccluSense app and can start your initial setup. And in this setup, you will be guided through every necessary step. So once your setup is complete, you don't need to remember this. I'm just showing you this so you've seen it once. Once you've completed the setup, you can then register your system.
Open your OccluSense iPad app, tap on menu item Settings, then choose Handheld Registration. Fill in the registration form. Please enter country, name, first name, street, zip code, city, and your email address. Tap the Register button to send your registration data. A confirmation email will be sent to your email address. Open the email and press the Confirm button. If your registration was successful, a green tick will be displayed.
And that is it. You're ready to get started. One thing I want to show you as well is the sensor test. So with an OccluSense starter kit, a test sensor will be issued. And this test sensor or sensor test is carried out the following way.
To initiate the sensor test of the handheld has to be connected to the app first. Now go to Settings in the OccluSense iPad app. Having your handheld and the test sensor ready. Now tap on Functionality Test Handheld. You will now be asked to insert the test sensor correctly and to close the sensor flap. Press the pink-colored control button to start the function test. The function test starts now. The result of the function test is displayed in the app. Now, remove the test sensor from the handheld and put it back in the storage box.
This sensor test you do like once a day. It's just to calibrate the system and ensure the pressure recordings have the same accuracy each time. So the system will automatically prompt you to do this, so you don't need to remember. Right, so this new way of testing occlusion may look very cool and digital, but do you really need this? In order to understand why an OccluSense might be a good way to test your occlusion is by comparing OccluSense with our standard occlusion measurements, so paper or foils. And I'm going to start with paper and foils and look at the occlusion using this pathway. So when you're looking at the occlusion of your patient with occlusion paper, to get from checkpoint 1, which is the very initial contact on antagonizing teeth, to checkpoint 2, which is the pathway in between initial contact and maximal intercuspal position, through to checkpoint 3, the maximal intercuspidation, you would have to continuously monitor the pathway from point 1 up until point 3 for an exact understanding of the three-dimensional process. And in this scenario, when you're using occlusion foil as a control measurement on your patient, you will only be able to see what is happening at point 3. So you have a snapshot of one single moment in time. With OccluSense, however, I have the opportunity to look into this process at any given moment in time, as occlusion as a whole does not consist of the final jaw position only, but the entire movement before as well. you can see a video recording over time rather than just a single snapshot at one moment in time. But do you really need this much in-depth detail for every single treatment? If you take an implant as an example, you know that the threshold for tactile sensitivity of an implanted construction is about 8 times higher than the threshold of vital teeth within their natural periodont. So occlusal interferences, as for example, a construction that is slightly too high, they will not present themselves with the same symptoms as they would on vital teeth. Therefore, any disbalances within the system, they will be transferred directly onto the surrounding tissues and cause, for example, CMD and further issues that can be caused by improper loading. But there may be plenty of other indications whereby an OccluSense can aid in much better and more precise diagnosis making. So you are able to detect interference contacts and hidden contacts very quickly. You can very early detect combined periodontal damage due to incorrect loading and look at the force distribution of the entire dental arch. If you don't have improper loading, then you can very much avoid chipping, and you also have the opportunity to record dynamic occlusion on splints and compare these recordings over time, as well as orthodontic changes. And any occlusion movements that you want to look at in general. What you're also automatically doing is documenting and can use it for patient education. To get started, you add a patient to your database, and you do that by adding the Add button on the top left side of your screen. And then you are able to fill in all the blanks with your patient's details. Once a patient is added to the system, you can activate them and then either look at their past recordings or start new recording. You're then prompted to adjust the time and the frequency of the recording on the iPad, or if you don't want to do it on the iPad, you can also do it on your handheld using the green button. And when you're ready to start, you then place the handheld in your patient's mouth and instruct them to conduct the movements that you would like to have recorded. The data will then be automatically transferred to your iPad, and that is what it would look like. As you can see, the colored marks will still be shown on the iPad, so on the patient's teeth, sorry. And then you can adjust the occlusion just like you would on occlusion paper and foils. When you press the pink start button on the handheld, the device will wait for the first occlusal contact and will then start the recording. If you need more information, we also have an instructions for use manual drawn up, which can be downloaded for free on the website and will also be delivered with any OccluSense package. And as you saw in the previous example, we have a way of displaying the information using different columns and colors. And what the colors tell you more about is the pressure that is being applied and the size of the contact points. So green points present an area of contact on a wider surface, whilst orange displays something in between green and red. And red means this is a punctual contact. If you look at the load of this bridge, for example, being transferred onto these two pillars, then you can see that the left pillar has a wider surface contact to the ground, which would accordingly be characterized by green columns. And the right pillar has a punctual contact surface to the ground, which is why it would be red. And as the height of the columns display the difference in pressure changes, you need to also remember that these pressures are always being compared to one another. So any pixel that is being activated on the sensor will also be compared to its neighbors. You can see this better in this unrealistic bridge, where you can see that small pressure changes between the green columns are characterized by green, intermediate pressure changes are orange, and the highest pressure change is then red. In order to transfer this knowledge onto the three-dimensional movement during mastication, you can try and imagine that you're standing on a plate covered with needles. And each of those needles is obtaining a different amount of pressure from the weight that is being put on it. Please remember that every needle that is being activated, so every pixel that is being activated, is obtaining a different amount of pressure from the weight that is being put on it. And if you're taking a little outline of this needle plate and compare the needles that are being activated to one another, then you can see that the largest columns are marked with the highest pressure change. So that would be red. And then it decreases in and changes the colors as described previously. Therefore, any red columns clinically will indicate high spots of occlusion, initial contacts, or standalone contacts that are not in full intercuspidation. Whilst green indicates a low pressure difference, so this can be anything like planar contacts, as for example on abrasive teeth, or adjacent contacts with similar pressure. Red does not mean alert. It simply indicates the large pressure change compared to adjacent contacts. So it doesn't mean you necessarily need to do anything. And as said, these contacts are always being compared to one another and are displayed accordingly. Now, if you take a moment to analyze this example of an OccluSense reading for static occlusion, you can see that in the right molar region at the back, you see no red columns. This does not mean, however, that you have no pressure, no high pressure here. In fact, if you look at the pressure distribution noted by the percentages around the scalings, you will actually see that the highest pressure within the entire dental arch, so 23 and 21%, nearly 50%, is located right here. And what this tells you is that there are no standalone contacts with high pressure changes compared to their neighboring contacts in this area. The contact surfaces are rather planar, but the pressure distribution overall of the entire dental arch is higher in this area. And the same level of detail you can conduct from readings for dynamic occlusion. I'm going to take you through a couple of features that I personally find very helpful. So you can amend the viewing options between two-dimensional and a three-dimensional view. And you can also combine the two if you prefer to see both at the same time. Apart from the viewing options, where you are also able to enter a full screen mode and turn and switch the viewing using your finger, you have the opportunity to obviously time, so pause, speed, and rewind any recording that you have made. You can do some noise cancelling by choosing the amount of pressure levels that you actually want to see, and look into percentiles or quartiles, as well as compare two recordings over time. So if you have a recording of a lateral intrusion to the left side from 6 months ago, and you want to see how this movement has changed over time, you can look at both and compare them. This is just to try and show and visualize the noise cancelling tool, where you are looking at less pressure levels than 256 and filtering what you really want to see. You can also export any of your data. So either you export a image, so a screenshot, or a video, This is exporting of a picture that is being shown to you, and you always need to enter the full screen mode. And once your full screen mode is entered, you are able to export either the picture or the video. A picture can be then saved onto your files or onto your Pictures app. So it's either PDF or PNG. And to export a video, you also go into full screen mode, but you start recording. And when you start recording, you have the opportunity by allowing your audio sequence to also speak some comments into your recording and change the view by using your finger. And everything you do within this recording will also then be exported by using the share button. If you want to use the app files, please take a look at our network access guide where you can see more details on this. To clinically look at the data, you need to ensure that your midline in the patient's mouth is also the midline on the sensor. So you have this red triangle or red line on the sensor where the midline is supposed to be. And this midline needs to be inserted into your patient's midline. So you can see this noted by the black arrow. And then all your OccluSense readings will also align. And when you're looking at markings on your patient's teeth, you can track every single mark according to the segments on the iPad app. So you can see that in the black lines, the arches in your sensor or on your sensor will also be the arches that you can see on the OccluSense reading. Taking this into consideration, you can now take a look at the blue circle where you can see a 2-point regular occlusion on a molar. The orange circle is your regular occlusion on a premolar. And please make sure that you take a look at not only the OccluSense iPad reading in the middle and on the right side, but also look at the clinical view of the dental arch to look what it looks like in your patient's mouth. And then you can see purple in your three-dimensional view. You firstly see that we have a very high pressure distribution as the arch is marked in orange, or the quadrant rather. And the percentages show you that 50% of the entire masticatory forces are located right in this quartile. And if you look more closely, it becomes very clear that the buccal contact on tooth 36, as a matter of fact, is a premature contact. You can do the same now with dynamic occlusion. And here you can see an unbalanced group guidance with most of the pressure being located in the bottom right quartile and a single contralateral contact antagonizing this movement. And now imagine 236 was an implant that we had placed. You can think of the long and short-term consequences that this improper loading could have on the survival rate of our implant. And exactly the same can be done with protrusion. I've got a few clinical cases for you here as well. So case one is a case of bruxism. We have a female patient who presented herself with ringing in her ear, the feeling of cotton, with cervical spine and ligament sheath prolapse. She also had a thyroid gland, which was super hyperactive, and some muscle tensioning between face, nose, and ear. And when you're looking at her static occlusion with OccluSense, you can see a primary pre-contact on 48. Looking at this movement a bit further, you see that there's unequal loading as well as a final heavy load between 41 and 45. Protrusional movement on OccluSense showed us parafunctionality on 48. And medial protrusion to the left and right also showed improper loading of 48 with the left side without canine guidance. And on the right side, we had some group guidance. Her bruxal movements showed main movement over 43, but also parafunctionality on 48. And when we looked at her nocturnal movement, we actually realized that she had this parafunctionality on 48 in centric position. So when we adjusted her occlusion very slightly, she actually turned out to have healed of all the symptoms that we had mentioned beforehand. So as we also know, slight occlusal changes can change a lot of general anamnestic symptoms that our patients may present themselves with. We don't always need someone with issues to take out our OccluSense and look at a patient's occlusion. So this is a patient where we've looked at the static occlusion, which is pretty much balanced. I'm going to go back. This was a bit too fast. I'm sorry. So if we look at this occlusion of our patient, this is pretty much balanced. Don't be irritated by the emptiness of the right-hand side in the molar region. Because this patient doesn't have antagonizing teeth in the fourth quadrant, obviously no pressure change can be detected. Therefore, we don't have any reading there. But the occlusion overall is quite balanced. And looking at her lateral protrusion also showed us to the left side a nice canine guidance with also the movement on 23 shown very nicely. And the protrusion also quite regularly. The final example I've brought to you today is an example of OccluSense and splint therapy and how you can use it to adjust your splint in a very highly accurate manner. If you look at the condylar processes on the right and left-hand side of this patient, you will see that they have very different shapes and forms. So we have a case of hemimandibular hyperplasia. And according to the differing development of the condyles, this patient suffers from craniomandibular dysfunction, whereby the occlusal interferences lead to teeth grinding, especially at night. And since the patient chose no surgical intervention, the primary treatment involves preservative symptom management, whereby we fitted a night guard to protect her teeth and joints. If you look at her static occlusion without the night guard fitted, please take a look particularly at the occlusal interferences and disbalances, as well as the force distribution. And you will catch an open bite on the left-hand side to begin with. And because you only see the contacts on the right side. And as the bite advances, the other contacts slide into place. I'm going to rewind this so it's a bit easier to see. Here we go. Right, so we have the beginning of the bite. You can see only contacts on the right-hand side. And then as the bite advances, we receive more contacts via sliding and gliding on the other side. Here you can see in the clinical image as well, on the left-hand side, she has an open bite. If you now look at her occlusion with the night guard fitted, what do you see? I'm going to go to a snapshot at the end of the recording. You will see that the contact points are roughly evenly distributed throughout the arch. And if you checked the occlusion of this splint with shim stock foil, this is what we do, you would have seen the exact same. And this is in fact what we did when we checked the occlusion in a standard manner with shim stock foil before releasing our patient. You see roughly an evenly distributed occlusion all around. And when this patient reintroduced herself and we then checked with OccluSense, we realized, wow, so this is what we see with occlusion papers and foils, roughly evenly distributed occlusion everywhere. But what we're missing is everything that happens before. So all this improper loading and imbalanced occlusion we actually missed. All we could see was the end with OccluSense, with occlusion paper, sorry. And the same checks can also be done for dynamic occlusion. The splint was fabricated for canine guidance using acrylic plateaus. So we can see some teeth in the front also guiding this movement, which we can then fabricate by drilling accordingly. And moving on to protrusion to then finalize the process. Okay, so maybe the most relevant question for you now, does articulating paper can be replaced by OccluSense? I would say it depends on the indication. So if you want to take a quick snapshot of a single moment in time, then you are good to use articulating papers. But if you want a detailed view of the three-dimensional occlusal processes over a period of time, and you want a video recording, you should grab your OccluSense. And the algorithm I can personally suggest to you is to use OccluSense to check for premature contacts and the pressure distribution. Then do any fine adjustment using articulating paper and foils, and control your results using OccluSense. What you're automatically always doing is you are documenting everything. And for forensic reasons, this might not be a bad thing. We have had experts all over the world who have kindly shared their feedback with us. So you can see that OccluSense is not only prevalent in the German market, and not only for standardized treatments, but experts with very, very different specialities, from CMD up until implantology, up until general surgery. They have used OccluSense in a very, very efficient and good way and shared their feedback with us. To get started, what do you need? You will need an Apple iPad that's produced in the year 2014 or later. You need an OccluSense iPad app, which is free to download on the Apple Store in 12 different languages. Any updates are also free. You need a Wi-Fi connection and the OccluSense system with the reference BK5000, which will issue you everything you need to get started. So that is all from my side. Thank you so much for your attention today. I will blend in my email address, which you are more than welcome to note down if you feel like sharing any cases with me, discussing any cases with me, you are unsure about the readings and want to find out what this could mean, or you have any more questions that you can't think of today, feel free to drop me an email. We can discuss this in the future. And if you have any questions now, I would obviously be more than happy to also answer them to you. Thank you very much for your attention again. Also, feel free to use the chat. If you feel comfortable dropping a question into the chat, then please do so. Okay, so right. The chat seems to be free and I can't hear any questions. I will suggest then, if you note down my email address and think of anything in the future, feel free to pop me an email. And if not, I hope that you have a very lovely day from wherever you have joined me today. And yeah, wishing you all the best. Goodbye.